Hi everyone, Jason Sabah with UBS. I'm a financial planner, certified financial planner. I don't have as many fancy acronyms, but I think it's pretty fancy. I certainly worked hard to attain that designation. So my specialty is in financial planning, so I focus on helping people to plan everything associated with their finances. So we're a financial service. We basically take it off your plate and handle it for you and lay out a roadmap. So my presentation today is preparing for a healthier future. And what it's largely going to focus on is long-term care. And so medical insurance is obviously an important piece of your long-term future. And that involves anything that's truly medical care, medically associated. But as you'll see in my presentation, long-term care is more focused on what are called activities of daily living. So I don't know if I have the clicker. Thank you. Thanks. Got it. Thank you. So what I'm going to do is I'm going to mostly talk about long-term care, as is evidenced by the agenda, but I'm also going to try to talk about it in the context of financial planning. So this is just one tiny sliver, very important sliver of your financial plan, and that's going to be the crux of the conversation today. But again, I'm going to try to have some context. So we're going to define long-term care, talk about the need, and what options might you have for planning for long-term care, what are your peers doing, both in California and across the country, and finally, how does that fit into your financial plan? And then I do want to leave plenty of time for Q&A, not only for my presentation, but also for Tim's. So what is long-term care? As mentioned, it is the coverage of needing assistance or supervision with what are called ADLs, or activities of daily living. So this involves eating, bathing, dressing, toileting, transferring, and continence. So what that means, again, is your Medicare or your health insurance isn't typically going to cover, helping you to eat or helping you to bathe or whatever it is. So that it essentially comes in, and this coverage or planning for this type of event covers these activities. From an insurance perspective, you're considered, you can submit a claim on a long-term care insurance policy if you can't do 2 of these activities independently for 90 days or more. So let's talk about the need, and I'm going to try very hard, I promise, to not use scare tactics here. There are some alarming statistics that I'm going to be covering today, and that's not I hate to use that to try to motivate folks, but this is the reality at the end of the day. So the first stat being 1 out of every 2 Americans age 65 today will need coverage for long-term care. So that number alone is pretty alarming, and I would argue even more alarming is that 1 in 3 individuals over age 85 today have Alzheimer's disease. A quick note about Alzheimer's. So by a show of hands, who here has a family member affected by Alzheimer's? Quite a few hands. And who here knows someone who has had a family member who has been affected by Alzheimer's? Nearly everyone in the room, right? It's really an epidemic of grand proportions, but it is one of the leading causes of long-term care services. So just a few stats that I wanted to point out, that I wanted to highlight on here. First, 5.3 million Americans age 65 and older have the disease. It's the 6th leading cause of death in America. 77% of adults with dementia receive assistance with the activities of daily living I talked about earlier. And finally, dementia is caused, 60 to 80% of dementia is caused by Alzheimer's disease. So let's talk through a few common myths here. So the first is a dangerous, but I would argue probably more common than a lot of us would like to admit, mindset that it won't happen to me. I hear about people doing it, it's not going to happen to me, but in fact, the numbers speak for themselves. Are 1 in 2 individuals over age 65 today will need long-term care. The next is there are the government programs. So as Tim alluded to, Medicare and Medicaid. So Medicaid, which in California is called Medi-Cal, does cover long-term care insurance, but that's reserved for lower income. It's actually below the poverty level type coverage. So I imagine it's not going to apply to many in here. Medicare does cover some long-term care, but it does have limitations. It actually only covers 100 days of nursing home care, and it has to be deemed medically necessary, and you have to have been hospitalized beforehand. So it's very niche. It's not going to apply to everyone's situation, certainly not more than 100 days. The next is that's what my savings are for. So people, folks, they save up, and maybe you have a very healthy financial plan, when in reality just a few stats. The national average cost for private room in a licensed nursing home is over $102,000 per year. And many folks who, at least at UBS, those who have an unplanned long-term care event may spend their savings 2 to 3 times faster than average. And then finally, I'm glad that we have the ladies in the room today, because women have actually borne the brunt of long-term care type claims. So the fourth misconception or myth being that your family will be able to take care of you. So women caring for ill parents are twice as likely to suffer from depression or anxiety if they're caring for an elderly loved one in a long-term care setting. And finally, the overall cost to a female caregiver in terms of lost productivity and lost wages is estimated to be about $325,000 over their lifetime. Skip that one. So just kind of going a little further on women, so 43.5 million Americans have provided unpaid care to an adult in the last year. So what that is you're caring for an elderly person and you're not being paid to do it. You're doing it because it's your mom or your dad or whatever. Typical caregiver is a woman, age 46, who spends 20 hours every week caring for her mother. And 75% of those providing home care are women, most often a daughter. And as Tim alluded to, the sandwich generation gap. So this is a kind of recent phenomenon. It's probably something that's been going on historically, but it's really kind of coming to light. Typical sandwich generation is someone age 40 to 59 who is not only caring for their elderly parents, but also is still trying to raise their children. So 1 in 7 middle-aged adults are providing monetary support to both an elderly parent and a child. And the affluent, to those making at least $100,000 per year, they are the most susceptible to this situation where to be in that situation where they're caring for both sides. So what does long-term? So let's see. So we're going to go. So I think this is a really important slide here, and what this is going to talk about is so UBS is a large wealth management firm, but we're also a large research organization, and so we take many of our clients and we conduct annual polls, and we try to gather information and draw some conclusions based on key findings of how our clients respond to these polls. So in the 2016 poll. We polled over 400 of our clients who are, higher, kind of, $1 million net worth approximately, and asked them these 3 questions. So the first being discussing long-term care with children. So as you can see, 61% of those polled had not yet discussed it with their children, while 39% had. And just a quick note on that before I jump to the other charts there, I'm fully aware. It's easy for me to say that, oh yeah, just talk to your kids about it and everything will be all great and you'll save money and everything. But I realize there are not only cultural but also emotional barriers in having that conversation. And so I just a quick finding from our study is that when parents include their children in the financial planning conversation, 9 out of 10 beneficiaries report being very satisfied with the outcome. So we all hear horror stories and maybe even know firsthand of some horror stories where the elder passes away, and then there's a fight over the estate, and then all of a sudden the family is disbanded, no one's talking to each other anymore. I can't emphasize enough the importance of having the conversation now. And that's something that I'm sure your church leaders here can facilitate. It's something we can facilitate. It's not an easy conversation, but I do encourage you to try to advance that forward. The next is you got for factoring healthcare into the financial plan, you got 50% investors have, 50% of investors haven't. And then saving for future medical expenses, the majority have not. So you do have programs like Medicare to cover a lot of those medical expenses, but there are some significant gaps associated with that. So Tim talked about having 80% coverage on a $100,000 procedure, right? So that there are still some out-of-pocket expenses. So those are things you need to be planning for, not only from a medical perspective, but also from an activities of daily living perspective, associated with long-term care. So what does long-term care look like? So, I talk about how do you obtain assistance for this, for needing support on these activities of daily living. So the first and probably most desirable is home health aides. So that's where you remain at home and you have someone come. This is probably the most expensive one. They all have different costs, but but you have someone come into your home and assist you with either medical, medical type procedures, but typically it's going to be, the activities of daily living. So eating, dressing, bathing, things like that. Assisted living facility. So this is kind of a retirement community is what I call it, retirement community with a couple of nice benefits. And that's that you've got someone who's going to be helping you with some of the activities, but is also going to be taking you to and from your medical providers. And it's a place where you have care nearby if you need it. And then finally, a nursing home facility is for someone who needs essentially 24/7 coverage for all these activities. It could be medical, it could be you need help bathing in the morning, eating your dinner, going to the bathroom, whatever it is. Nursing homes provide that facility, provide those services. And so know the costs. So this is probably, maybe it's Alzheimer's is all scary. This might be the most scary to some of you. So I promised, I think this is the last slide that no, I do have a slide with money literally burning on fire. So that one's still coming. So that one's coming up. So the cost in California may surprise you. So the average annual cost for a private room in a skilled nursing, so skilled nursing is essentially a nursing home, is $132,900 a year. So over $10,000 a month. California average monthly cost of a private one-bedroom unit in that residential care facility. I'm painting this picture of this nice retirement community with golf and tennis and music room and all that stuff. That is just under $5,000 a month. And then finally, the average hourly rate in California for a home healthcare professional is about $24.15 an hour. So what are your options? So as I mentioned, Medicare is one, but Medicare does have its limitations. So Medicare is that senior health insurance that you've all been paying into as part, I think about 6% of your pay up to a certain limit is going towards Medicare, which is great for health type expenses. However, anything towards activities of daily living, it's going to have a lot of shortfalls. So really all that it covers is 100 days of nursing home care. Medicaid or Medi-Cal in California, what that is, again, that's for low income type households. There are creative ways that working with certain elder law attorneys that they can divide your assets and put them into trusts and other type things where you would qualify and be considered a low asset person. So that's a more creative way to navigate it. It is possible. So and then some might be thinking, okay, I'm just going to give all my money to my kids or whatever, and then, hey, surprise, I don't have any money. I'm ready for my Medi-Cal. There is in California, there's a 30-month look-back period. So they look back 30 months to make sure that you're not just giving away your assets and then saying, hey, I don't have anything, give me coverage. So the other is family. I mean, that can be nice for some. That's certainly not the reality for most, is that you have family just prepared to pony up and pay for those types of things. But that is the reality. That's probably the direction that most people end up going. And then in terms of insurance, so traditional long-term care insurance, quite expensive in my opinion, because candidly people are living longer and healthcare costs aren't going down. But what just straight up long-term care insurance provides, it's like term life insurance. So what it is, you're paying for a benefit, you're paying an amount every month in insurance premium so that you can ultimately submit a claim and have money to pay out if you have a long-term care type of event or you get to a point where you need long-term care assistance. However, if you don't end up needing the long-term care insurance, there's nothing to show for your money. So it's like term life insurance. You pay in, and if something happens, then there's a benefit. If not, then there's no benefit, and there's nothing at the end of the day. So long-term care insurance, arguably a little expensive, and also you're not really building any cash value in terms of that money. The money just goes in, and it's only paid out if there's a claim. And then the final one, which I would argue is probably most important, not most important, but I would argue most applicable to most situations, is to incorporate a long-term care, what's called a rider, into either a life insurance policy or an annuity type policy. And what that allows is you have some sort of life insurance or you have some sort of annuity. What annuity is, it's an insurance contract where you put money in and then the insurance company guarantees to pay you a lifetime income. It's like a personal pension is what it is. And you can say, okay, that sounds good, annuity company. I'd like to buy this policy. And by the way, if I have a long-term care issue, I want you to pay for that, extra for that. And they can incorporate that into the policy as well. And then finally, the I guess sixth option that I didn't list here is if you're worth, you know, $20 to $25 million, you just pay for it. So finally, here's the scariest slide of the day because I'm literally lighting your money on fire. So will long-term care disrupt my retirement plan? And then I'm going to try to put a positive spin on things. So long-term care expenses can disrupt an otherwise well-constructed financial plan. So depending on the net worth of the household. So by adding a long-term, so what we do at UBS, just to give you some context, we look at someone's entire financial situation. So we're not just looking at their stocks, we're looking at their real estate and their debt and their insurance and inheritance and everything. And we're laying out a life plan for them. So we say a financial roadmap, essentially. And so we take this plan and we say, here are the chances of you being able to fund your retirement and sending kids to college and starting a business and going on vacation and giving to charity, giving to the church, whatever it is that you want to be doing. And we assess the probability. And so what this shows is we say, okay, here's your plan. We're going to throw some long-term care in there. We're just going to throw that in the plan, 10 grand a month for your nursing home care for 5 years. See what that does to your plan. So 32% of the time for households that have $1 million or less, they ran out of money. 9% of the time for $5 million households, and then those lucky ones at 10 million plus, 5% of the time, they ran out of money. So how do you begin planning? Just to kind of put a bow on it, what we do at UBS, and I am not trying to make a commercial, but just to let you know, we construct a financial plan. And we have a 6-step process associated with determining your goals and objectives, finding out how much risk you can tolerate, and that's certainly an in-depth conversation, developing the investment strategy and how we're going to allocate the assets. Then we we construct the portfolio, we execute the investment strategy, and then always monitoring and making adjustments. What's important is long-term care it fits into your entire financial plan. Everyone's situation is different. And so the beauty of the planning process is that it can include everything and we can plan for a variety of scenarios. With that said, I know I was a little quick, but I did want to leave enough time for Q&A. So thank you.